name is Arnaud Mazier. I'm a PhD student at the University of Luxembourg, working with a French company called Anatoscope. And today, I'm going to show you my work on how we use digital twinning for improving breast cancer surgery. But first, did you wonder how our surgeon was planning a surgery, actually? So, like an architect, they use drawing. They draw on the skin of the patient, so they could do some landmarks or a visual map that the day of the surgery will be used to guide the surgeon's tool. This will highly affect the operation success as well as the visual outcome. However, some drawing can be really difficult to do, especially depending on the surgery. They could be really complicated and long to do. Another aspect is that they could be really challenging for an experienced surgeon, because every patient is unique, which makes every drawing unique too. So my aim is to provide for any surgery of any patient a patient-specific drawing. To do so, we'll use digital twinning that Saurabh previously introduced. So digital twinning is basically make a copy of the patient, but on a computer. This will allow us to first train on the computer and then to operate on the patient. To do so, we need to acquire some data first. For our application, we will use some surface scan. So we used a depth camera, which is nowadays present on every tablet or every smartphone. Then we circle around the patient. This will allow us to reconstruct the 3D shape of the patient. Then we will use registration. So registration is the fact of deforming a model to fit the patient's data. Here, I'm showing it on a bone, where we deform one bone to fit another patient's bone. But the bone is quite a simple geometry compared to the breast. Indeed, we needed to design a template torso model. This model is made of a skin which is embedded with virtual bones. Those virtual bones will allow to modify the joint opening, and also by using a database, we learn what were the main important deformations to pass from one patient to another. Surprising for breast cancer, it's mainly the breast cup or also the waist, many deformers. Then we ask the surgeon to do the drawing on this model that you can see with the curves. And we also added some anatomical landmarks that can be useful for the surgeon, such as the nipples or the sternum. And this is the patient scan. So as you can see, it is sometimes quite incomplete because surgeon doesn't have a lot of time, so they don't want to spend 1 minute, 2 minutes on doing it, so they do it in a rush in 30 seconds. And then we identify the same exact anatomical landmark that are the red dots. Then we take our model and we deform it to fit the patient's scan. As you could see, it is quite fast. It takes less than 3 seconds, and we are able to predict what is the adapted drawing on the patient. We could also see that we have a pretty good match of the anatomical landmarks and also on the surface. What I want to stress here is that this method is highly flexible. It can be used for any kind of surgery. So if we take another pattern, we will be able to fit it. And it's also able to fit any kind of surgery. Could be for leg, could be for the arm. So we tried this method with the surgeons. They were quite happy. But they want to push it one step further. They want to go into augmented reality. So instead of spending time on drawing on the patients, they want to directly see the drawing on the patient. So this could be achieved with augmented reality on the left. And then, like Saurabh said it before, they want also to be able to train themselves on surgery. So this could be achieved through virtual reality. But maybe with a further collaboration with Saurabh, we'll be able to make it happen. So that concludes my talk. Thank you very much. And if you have any questions, feel free to ask me.